On behalf of AMA Private Practice Simple Solutions, welcome to Marketing Primer 3, Building Trust in Your Practice Through Public Relations and Community Outreach. I'm Rob Rosenberg, President of Springboard Brand and Creative Strategy, who along with my colleague Donna Arbogast will be developing and presenting the content in this marketing series. This primer will explore and discuss how private physician practices can better understand and use strategies of public relations, community outreach, and thought leadership to become a valuable resource in your community and among your patient base. Please note that an accompanying learning guide for this primer is available online with extensive insights and discussions on these best practices in marketing. Additionally, this primer builds on the previous two, also online, focused on your unique marketing advantage and the use of market research to better understand community and patient needs. The content of this primer includes defining terms and understanding the value of public relations and community outreach, discussing the shift in public relations that has occurred in the content era. What once was a media relations-focused strategy has now pivoted into a key outreach opportunity for you. Thought leadership is one of the most influential marketing approaches, and we want to talk to you about positioning you and your practice as a valuable community and patient resource. Community outreach is another marketing and opportunity to engage with current and prospective patients. We'll discuss opportunities available to you as well. Lastly, we'll share tools you can use to align and organize your PR and outreach program. Let's start by defining key terms, since oftentimes these marketing disciplines can be referred to in many different ways. Public relations. This is the strategic communication that strengthens your reputation with critical audiences, establishing you as a valuable resource and builds mutually beneficial relationships. Thought leadership. This is a form of public relations and focuses on critical issues and topics about which you have a unique expertise or passion, making you a thought leader in your community. Community outreach. This is an extension of PR. This marketing strategy is a visible expression of your efforts to build relationships through events or local initiatives that you support. We'll get into all of these in more detail during this primer. While complementary, each of these disciplines plays an important role in helping you build trust in your community. The role of public relations has shifted greatly over the last decade. In the past, it used media to share stories that present organizations in a positive light and strengthen trust. The ability to get coverage in newspapers and other vehicles was a critical piece of this strategy and often difficult to achieve. Today, you have the opportunity to create and share your own content to build relationships and establish yourself and your practice as a thought leader. We are in the content era, and through an online presence, you can reach key audiences directly with articles, blogs, emailed newsletters, and social media, among others. This will help immensely in your ability to position your practice in your community and get the coverage that you require. Why and when would you engage in public relations and community outreach efforts? A good question that we hope to answer. First, PR and outreach give you the opportunity to establish your practice as a trusted resource for health expertise, education, and information. While marketing and advertising tactics can support the effort to drive immediate and measurable results, PR and outreach are long-term investments in building a foundation of trust among those you serve. When do you use these tactics? Well, selection is key to success and sustainability. You don't need to, nor should you, write or speak about every hot topic or say yes to every request to participate in or sponsor an event. Instead, you should strategically select those initiatives that align with your marketing advantage, and each initiative should connect with and support the others. Once these initiatives are established, it's important that they be strategically aligned. all around your unique market position, as discussed in Primer 1, from a promotional standpoint, whether your website, search engine marketing, advertising, through public relations and outreach, blogs, events, sponsorships, speaking opportunities, through social media, Facebook, Instagram, LinkedIn, and others, all should be, again, around your unique marketing position. That way, you'll be able to develop a singular and strategic focus in the marketplace and for your practice that you'll be able to carry through all marketing initiatives. Now I'd like to turn it over to Donna to go deeper into public relations in the content era. Donna?
Thank you, Rob. Now we'll dig a little deeper into the idea of content development and its role in establishing and nurturing trust with your key audiences, the patients you currently serve, and the community in which you work. Let's discuss the basics of blogging and making sure your patients and community see and read your articles. First, blogging content should always be informational and educational rather than promotional. If readers feel like you're promoting or pushing a specific technique, product, or treatment plan, they will be less likely to engage. If they feel that the information you are sharing is educational and will help them make decisions about their health, they will be more likely to feel a sense of appreciation and trust. Second, the messages should be relevant to your audiences, which you can assess by reviewing the profiles you identified during the marketing advantage and research steps. What do your patients need to know? What are the major health challenges or opportunities in your community? To be most relevant, this is a good starting point for thinking about your blog and the topics you want to write about. And ideally, you should also offer actionable insights in your blogs, something that people can do to improve their health. Think about crafting your blogs when appropriate around a certain number of steps, for example, like 3 steps you can take to improve the health of your heart today. That gives something for people to focus on. It's a nice angle and a great way to engage people in your blogs. Where does your blog content live? It lives on your website. If you use a straightforward web platform like WordPress, you can download their blog plugin to make it very easy to write and publish your blogs. You can find helpful guides on LinkedIn, Medium, and HubSpot, among other sources. They offer how-to articles about blogs, best practices, and videos related to blog length, topic ideas, posting, and promoting. And you can stay up to date on new blogging features in whichever web platform you choose. So if it's WordPress, they often send notifications about new resources or ways to improve what you're doing currently. Okay, the big one is, how do you select your blog topics? Because selecting it can feel very overwhelming, but we encourage you to start narrowing things down by using the work you have already done to identify your market position, your patients' interests, and your community's needs. The topics you select for your blog should align with these key factors. So, for example, if you've determined that your practice will have or already has a specific focus on older patients, topic ideas might include vaccines after 50, what you need when you need it, or preventing falls, how to conduct a home assessment. If, on the other hand, you're focusing on younger families, topic ideas might include tips for communicating with your kids in a disconnected world, or healthy eating and snacking for growing bones. Other sources for topic ideas can come from the nationally designated health months or weeks, which can be found in the link that we provide in the learning guide for this primer. And we recommend subscribing to other health-related blogs to spur your thinking and talking with your own team to find out what topics patients seem to be most interested in. Let's look at length, frequency, writer resources, and blog management. So first, with length, you're probably wondering how long your blog needs to be and how often you should post and how you can manage this commitment. As a general guide, blogs should be approximately 1,000 words. The longer your blog, the better it will be for optimizing search results on Google. So, for example, if patients are searching for the topics we listed above, maybe vaccines for people over 50, your blog could come up in that search, particularly if you use that topic in your headline and the subheads in your blog post. You want your blogs to help patients find you online. So yes, they are relationship building tools, but they are also marketing tools. As for frequency, we recommend posting weekly if possible. If this is too much, follow the guidelines of quality over quantity. Try to post regularly on the same days of the week so that readers know when to expect your posts. If you need some help with writing, consider some additional resources. Members of your staff may be interested in writing blogs on topics of interest or within their areas of expertise. Your local hospital's marketing team may have recommendations who could also help you. And you may even consider asking non-competitive colleagues and referring physicians to be guest writers on topics within their particular areas of focus. And finally, from a management standpoint, it is very important that you maintain control of your blog account. You should review all content before it is posted, and you should be the account owner. Establish these rules at the outset, share them with your team, and that should be a very simple process. To help you manage your blogs, work with your team to create a content calendar that outlines your topics, who will be writing the blog, who will be creating the promotional posts on social media, and what the deadlines are. A content calendar is literally just that, a calendar that serves as your guide for this initiative. Calendar templates are often available in plugins or widgets that you can access through your web platform, such as WordPress. Remember to review and discuss the proposed content and calendar regularly with your team so that they can provide valuable insights and feedback on the ideas. And align your calendar with your clinical calendar when possible. So for example, if you plan to participate in any community activities during Heart Month in February or during the Great American Smokeout in November, align your blogs with this kind of activity. An important point to remember about blogs is that they do not follow the adage, build it and they will come. You do need to let people know about the wonderful content you've created. But there are ways to leverage what you are already doing to drive people to your blog and increase engagement. Use your social media sites, particularly Facebook and Instagram or LinkedIn if you have it, to promote your blog topic. Share a key point or two from the blog in your social media post to encourage readers to click and read the full article. Use your email database of patients who have agreed to receive content from you and include a subscribe button on your blog to engage new readers. Include promotions of your blog in posters and brochures in your office and at events and speaking engagements. Put a QR code on these materials to make it easy for people to connect into your blog and subscribe. If you use follow-up emails or text messages to patients, you can promote your latest blog topic in these messages as well as appropriate. But one word of caution is only communicate with patients who have agreed to receive your emails and texts. Pulling it all together, here is a sample content calendar that shows how to list deadline dates and publishing dates, the topic, the channel, for example, your blog or your social media sites, the author, and key messages. These columns can be modified to suit your particular needs, but the important takeaways are: plan in advance, align with your practice's marketing position and patients' needs, assign topics and set deadlines, and review regularly with your team. Following these takeaways will really help you make this process effective for you and your practice.
Is thought leadership right for your practice? If you have identified a topic or issue that's of great interest to you and your team, and it aligns with the needs of the community and patient, yes, it's right for your practice. If your name repeatedly appears when this topic or issue is featured in local news, in your communications, at events, your patients and your community will begin to recognize your expertise. The single issue strategy can position you as a leader and support your marketing goals. How to build your reputation on this topic? First, leverage your blog, your social media posts, your community outreach activities. Share your blog posts with others who are influencers and can establish you or help establish you as a thought leader. Area reporters, local legislators, organization leaders, and PR leaders. Then lastly, schedule speaking engagements on this topic by connecting with local groups or leaders involved in the issue that you're interested in speaking on and becoming a thought leader. These are all ways that you can build your reputation on the topic you've selected. Now let's get into community outreach, ways that you can participate and sponsor events. Here's Donna to walk you through this. Donna?
Another way to build relationships is by participating in or sponsoring local events. You are likely asked very often to participate in health fairs or sponsor a local race or health-related fundraiser, or maybe put an ad in a program. These requests can become overwhelming, but with a strategic approach, you can identify which events can work for you, your patients, and community. To determine which events to consider, start, as always, with your practice goals and marketing advantage. Does the event in question help support a goal, and does it align with your unique marketing advantage? If you're researching events on your own and not just responding to incoming requests for participation, look for those that are sponsored by organizations that have a similar interest to your own. For example, if one of your practice goals relates to increasing awareness of smoking cessation and early lung cancer detection, reach out to your local chapter of the Lung Association or the American Cancer Society. What events do they regularly sponsor, and is there a logical and manageable way for you to partner with them? Here are a few tips for maximizing the impact of your community outreach and sponsorships. Select events that allow you to reach your target audiences, that require a minimal amount of resources, either staffing, materials, time, and funds, that offer ways to measure results. So, for example, can you register subscribers to your event to your blog at the event, and can you do it on site to track impact? And events that provide practice recognition in social media, signage, an organization's website, media relations, or interview opportunities. Establish a budget for your outreach efforts each year. That will give you a really good guide as to whether or not an event is worth participating in. Link your outreach efforts to your blog strategy. Write about topics related to the event in which you are participating, and promote this in social media and in your emails, because that will reinforce all of the work that you do, as Rob showed in the graphic earlier in this primer. And develop reusable resources, everything from informational handouts to simple practice ads for community events and programs or online promotions. Keep it simple, on message, and aligned with your goals.